Pharmacology. So, pharmacology, if you're not aware, is a second year medical school class that is a full year class. So, obviously, we don't have the time to know pharmacology in that great of a detail. But essentially, it's made up of two key topics, which is pharmacokinetics and pharmacodynamics. Pharmacokinetics is uh, excuse me, pharmacokinetics is the motion or the movement of a drug over time, and pharmacodynamics is basically how it is absorbed and regulated throughout our body. One of the papers that I've attached in the additional learnings, the key principles of pharmacology, really defines this to a great detail. So it has pharmacokinetics, the types of ADME, which we'll get into, the pharmacokinetics, bioavailability, bioequivalence, as well as pharmacodynamics and extended readings. If you go down this document, you will see that it's detailed enough for the non-pharmacologist to understand it quite well. And it serves as a great resource material for you to read later. So one of the key aspects that we try to understand, especially in pharmacology, is ADME, right? So it stands for absorption, how will the drug get in, distribution, metabolism, and excretion. So absorption is how it will get in, and in the next slide, we'll see various ways that drugs can get into the body. Distribution is where will the drug go within the body. Metabolism is how is it broken down by the liver, kidney, or other organ systems. And then finally, excretion, how does it leave the body? The absorption, there are essentially 7 ways that a drug can get into the body. And from a commercial standpoint, it's really important to know these routes of administration, ROAs, right? So the first one is oral, which means the substance is taken up by the mouth to be absorbed by the stomach or intestine. Sublingual means the medicine is dissolved underneath the tongue. Transdermal, which means it's contained in a patch and absorbed through the skin. Rectal means the medicine is inserted into the rectum. Inhalation, where it's inhaled as a gas, aerosol, or mist. Intranasal, which is different, which is absorbed through the mucosa of the nose and into the bloodstream. And finally, parenteral administrations. So there are intravenous, intramuscular, subcutaneous, SQ or subQ. And these routes provide sort of a faster response than oral or rectal routes and avoids unpredictable absorption through the gastrointestinal system. However, it does require sterile conditions to prevent infections. So when we think about sort of drug development and what sort of formulation it has and how it gets into the body, what type of absorption really matters, because intravenous or intramuscular or subcutaneous are both take longer and is more of a patient burden than obviously, taking tablets for oral administration. When we understand PKPD, this is one of the more famous graphs. And what that shows you is basically how a drug in a concentration in the plasma is given over time. So when you administer the drug, there's a time frame, Tmax, where the drug has the highest amount of concentration in the plasma, and then it decreases over time. On the right-hand side, you have sort of the maximum safe concentration of the drug and the minimum effective concentration of the drug. And in between that time, you have this therapeutic window as to what concentration will generate an effect of the drug. And then how long that lasts, this duration